So Bob emails, what do you say?
Yeah.
Middle tier patron Leah from LA. She says, "Hi, Dr. Kirk and Bob. I love your content, but particularly your email episodes and deep dives. And I have a soft spot for your reaction videos to Love is Blind, where I originally found you. I appreciate the recent series on borderline abuse that you made. I totally understand how much time and how many decisions go into producing content, so I hope people commenting on YouTube will lay off criticizing silly things like the thumbnail or the length of the episode. I recently listened to an episode where you responded to a question about using service dogs." So this is to you, Bob. "I recently listened to an episode where you responded to a question about using service dogs to advance therapy outcomes, and you both agreed that whether it would be beneficial depends on the situations.
Yeah.
For example, if I understood correctly, you both agreed that when someone with anxiety uses a service animal or anything as a sort of totem, it could be counterproductive to recovery from anxiety. So, Bob, I want to know if this is your stance and if you could elaborate on it. But before that, I just want to say I don't remember having that point of view, because that's not really I don't really have a strong opinion about this. So I want to say that from my memory anyway, but I could be wrong, this was mainly your thing.
It is.
And for me, I was either agreeing with it or just, saying, sounds interesting.
Standing by, yeah.
Yeah. But is this your stance?
Yeah, it is. There's research on folks with elevator phobia. And what they did is these folks, they had a group of elevator phobes, and they split them into two conditions. And in one condition, the people could go up and down the elevator with, their lucky rabbit's foot or their lucky stone or whatever. And in the other condition, they couldn't. And they both did the same treatment right up and down in the elevator. And however long the treatment lasted, days or weeks or whatever. And then they let a little time pass, and then they put everybody on the elevator and they measure phobia. There's some kind of measure of anxiety, right? So the people that did not have their lucky rabbit's foot or stone or whatever, rabbit's foot is such a weird thing for people to collect. I mean, my sister had one when we were kids, and I didn't think anything of it, but now I'm like,
I remember learning the history of it.
What's weird?
But I don't remember now. Yeah.
Yeah, it'd be like, oh, yeah, this is my cat's paw. Like, who does that? It's weird.
It is very weird.
Yeah. Oh, hey,
they don't. I'm sure they don't do it anymore, but it was a common thing when we were in the 70s and 80s. I would venture to say a third of my friends had, usually not on them, but maybe in a drawer in their room, they had a rabbit's foot.
It's weird.
Yeah.
Yeah. So anyways, so those folks, when they didn't have their totem and they went up and down the elevator, were significantly more anxious and in fact had almost no treatment response compared to the folks who did not carry their totem. So the reason I think service dogs is, potentially problematic is because they can act as a totem. We can keep them with us as a totem, as if there's some magic power, imbued in this, beautiful little critter that keeps me safe. That is not a fact. And so if I want to get over my anxiety, I really have to live as if, let it come, right? So if it's elevator phobia, then let it come. If it's fear of heights, then let it come. Am I against service dogs? Hell no. No. And actually, if somebody had anxiety and this is what they did to help themselves, like, okay, great. Man, it's your life, right? Or what am I going to stand by and say, well, you're really not optimizing your...
Have you ever been annoyed by a service, a quote unquote service dog or, not service dog, but therapy animal?
Annoyed by the animal?
Like in public?
No.
Okay.
No, I love dogs.
Because there's a lot of people who will get annoyed, they're on an airplane or something, and it blossoms into this point of view where they will look at research to bolster their personal opinion that it's just annoying to encounter these animals.
Oh, I don't feel that way. In fact, I don't interact with service dogs because they're service dogs, and most of the time the person with them they're not a pet. So they don't want you to meet the dogs.
And I don't know the specifics, but I'm pretty sure there's a very big difference between a service dog and a what's the other term?
Emotionally
support dog.
animal.
Yeah, there's a huge difference.
Yeah.
Huge difference.
Right.
A service dog would help someone who has a condition or a disability that they would not be able to function otherwise without. You know what I mean?
Epilepsy or some kind of paralysis that interferes with you can't or blindness.
Right.
And those dogs, man, they work hard. They're
highly trained and they're really well behaved and da da da.
Yeah.
Whereas a emotional support animal, it could run the gamut.
Yeah.
Again, it's not my area, but I would take a guess and say that a lot of emotional support animals are just people's pets and have the normal level of training.
Right.
In terms of how to interact with strangers and da da da.
Right. Yeah, exactly. So would I tell someone though who had an emotional support animal that they shouldn't have it? No, I would never say that. And in fact, the little bit I know is that when vets who have PTSD come back, if they have a dog, they tend to do better. I think they tend to do better because they have something to love and put love into, as opposed to, the emotional or the treating anxiety. I don't think that using a service dog to help mitigate anxiety, if that's its purpose, I'm probably doing myself a disservice by having that. But I think most of the time, with vets anyways, it's not for that. It's to have something to put love into, and that's a really good thing. That's a healing thing. So I am for people having dogs that, or cat, whatever. I'm pro, but I'm also realistic. And if we're talking about phobia, then I can't get behind it. So I've had clients, in the DBT, students in the DBT class who have emotional support animals for purposes of anxiety. I can think of 2 cases when this came up, and they wanted to bring the dog to class. And it was a real bind for me because the ADA says you're not allowed to get in the way of that. So I said to them, the ADA says I'm not allowed to interfere. So if you want to do that, you can. Here's the downside. The downside is I might have another student that has an allergy to dogs, right? And so, it doesn't mean that you can't bring it. It means that, or fear of dogs. It means that this is a consequence of doing that concerns me. And the other thing is there's this research on the use of totems and how it can get in the way. Now, I'm not here to tell you what to do. I love dogs. And if you brought your dog, I'd probably be very, very happy to meet it and play and, whatever. It'd be fun. And we have had, occasionally people have brought their dogs to class or whatever. And, it's lovely. It's fun, right? They're usually a lovely addition. And they actually make the mood in the room, they improve the mood in the room because everybody loves dogs. And why not? They're the best. They're the best. I have to tell you something about dogs in a sec. But in terms of anxiety, I feel like I'm being asked to participate in somebody's demise. And that is
enabling a destructive coping mechanism.
Yeah, and that bugs me. I don't want to do that. Mm-hmm. So yes, the rules are such, and if you do, then okay, so be it, and we'll learn. And both times when I've had that conversation, both people opted to not bring their dog to the class. I don't know what they did in general about helping themselves with anxiety. I feel like they were at least armed with some research-based knowledge to, consider. But
do you believe that helped because, you wouldn't know because you're not as close to these students as you would be to a client regarding assessment, but did you see evidence or did you wonder if this principle was at play and that they had anxiety about coming to a class and it was a new scenario for them?
Right.
And they wanted to bring their totem, and having at least some kind of suggestion of making, of it being potential hardship, they're just like, okay, well, I guess I'll leave my totem at home. And they were better off for it in the end because, I guess in terms of the research, that if they did bring the animal, then they are dependent on that animal being around, and overall if they didn't, you know, say they have to go to work and they can't bring their animal, their anxiety would be even worse than if they hadn't had come to therapy to begin with.
That's entirely possible. I never assessed for it. I think both times there was a certain amount of social pressure, and you know, me being the teacher, I have a perceived a sense of authority. I have a perceived authority, which you know is actually true, but I don't want it. But it is still.
But
true.
I think it's a great approach because you're not saying no, but you're just saying this is the scenario. Let's all be adults, and I'll tell you one adult to another what the landscape is, and you can make that choice given you know how you see it.
Yeah, as I recall, both students seemed to benefit from flying solo.
Okay.
Without their service pup.
So you had a story about dogs, you said?
Yeah, we're getting one.
Oh, you are?
Yeah, I just found out this morning.
Okay. This is a big deal.
It is a big deal.
So if I may.
Yeah, please.
You had a dog, Rosie, for,
yeah.
I don't know, 12 years or something?
14.
And she was a great dog.
Yeah.
And had her elderly years where she was not as mobile, and had some quirks later on in life. But you and Colleen really loved this. Colleen in particular, right?
Oh, yeah.
Yeah. And, you know, as the three of you spent a lot of time together.
Yeah.
You and Colleen
that was
and
my
the dog.
family.
Yeah.
Yeah.
And
Well, that is.
when Rosie died, it was, of course, very hard.
Yeah.
And the two of you, I think, vowed that you would never have another dog because you didn't want to go through that pain again. Is that right?
Colleen had that, you know, I think that's a pretty common sense of things when, you know, you lose someone close to you that, you know, okay, I'm not going through that again because grieving is so painful. I'm not a pet person. I never wanted a pet. I got 2 cats sort of foisted upon me back in the day by the Todd. The Todd, man. The Todd is a funny man. Anyways, and then Colleen wants a dog. Okay, then we're getting a dog. I mean, you know, who am I?
Did you not grow up with pets?
Yeah, I did. But that was back in the day when pets were like, you know, the way they used to treat, you know, they should be seen and not heard.
Yeah. Yeah, we had cats, but I don't think they were allowed in the house.
Right. It's kind of trippy nowadays. It's like,
yeah.
So we had pets, but that was before anybody really paid attention to pets the way we do now, or at least the way a lot of people do now. Is a really good thing. I think an evolution for you know, the world that we pay attention like that.
Well, I have a lot of opinions about that, but just a short little asterisk. Of course, I love animals and would have 10,000 cats and dogs if I could. And I think that our dependence on animals as a replacement for human attachment is a problem.
Oh, yeah.
I don't think we should get rid of the animals, but I think it's a symptom of the fact that we're attachment and touch phobic, and we're also so isolated.
Yeah.
And so it's meant, you know, as a manifestation of our needs, it's just like we've turned to pets as a solution, which is, I mean, it's not like it's a fake attachment. It's real, but I just wish that we could all have, you know, less loneliness and more attachment, more touch in our life.
There's a cost to isolation. Yeah, we shouldn't get rid of the pets. We should get rid of the internet. Okay, fine. Anyways, so yeah, this morning, yesterday, she had an interview with this rescue agency down Houston, Texas, and there was.
But what sparked the change of heart to get a dog?
I don't actually know.
It was her.
Oh yeah, it was Colleen. Yeah, so sometime in the last few months, she started looking on Pet Finder, which that's
it's one of the things that we give money to.
You give money to, yeah. So she started looking around, and you know, every dog you see is cute. They're all great.
Yeah,
right.
It's so. I mean, once you. Yeah. I mean, that's part of the problem is you can't have them all.
Right.
But the nice thing is in the United States anyway, almost every animal on Pet Finder is going to find a home.
Yeah.
You know?
That's good.
Yeah.
Yeah. So she's looking, and she'll show me the dog, and it's like, look at this dog. And I'd say to her, oh, we getting a dog? And she'd say, well, I don't know. No, I don't, not right now anyways, blah, blah, blah. And then last week she said to me, I've seen this dog. And they show you, there's a pretty detailed write-up and a bunch of photos and a video of the dog in various environments, and so that you can get a sense of, and these foster families, they're these are dog people. These are dog people. So they really pay close attention and understand dogs a lot more than the average bear. And so yesterday we had she had an interview. I was there for a little bit. She had an interview with this dog and the family. So she met the dog over the internet and over the the camera or whatever, and talked with them at length. I think about 40 minutes. She was on the phone with them. And then later that day, I didn't know she was going to do this. She found another dog that looked like a miniature Rosie, looked like Rosie, but about a third the size. And I was like, well, awful cute. And so she's like, well, yeah, but would that be being a reply? I'm like, I don't know, but if whatever, right? And so it's fine. So she actually met that dog. And
do you want a dog?
Me?
Yeah.
I do not have strong feelings one way or the other. I know that when we get a dog, I will love the pup. I will not like saying I love you, pup, because that makes me like attach, and I don't want to do that. But I will enjoy pup, and I really enjoyed Rose. Rose, yeah, there were some big problems later in life, were some health problems, and she had to get up at pretty much 1 a.m. every night to go outside. Sometimes just to stand there and smell the air, and then turn around and come back in. Some cognitive issues or whatever, and I never grudge her. It's like, okay. Then I guess we're getting up at 1 a.m. and then we'll get up at 5 for breakfast, and that's just going to be life. And me and Colleen, we split duty, and it's fine.
And Rosie died a couple years ago?
A year and a half, almost to the day. Yeah. She fortunately, very short period of suffering, pretty bad suffering. And then she passed. So, there was not going to be a dog or a cat in my house, at least for a while. And, but Colleen is, she's through her grieving, or she's not through her grieving, let's be honest.
At a point in the grieving
where there's room. And so this morning I got up and walking around the house. Howdy, how's it going? Yeah. And we're getting Pete. His name's Petey, but we're not going to keep that name because my brother's name is Pete. Can't do that. And so we're considering names, and she's got a couple picked out that I really like. We'll see.
So this is the little one?
No, the bigger one. Yeah, the one that she met first, and she's like, oh, he's so cute.
How old is that dog?
They think about 1.5 years.
Okay.
Yeah, so young. But a rescue, so nobody knows for sure.
But it's kind of a good age because, our 2 dogs are both rescues. Our bigger dog was found in a cemetery in Louisiana, and the other was part of a litter of puppies that was dropped off somewhere or something. And the bigger dog, we don't know how old he was, but 6 to 12 months. And by that point, they're easier to handle. They're easier to train. They're of known size that and puppies are great too, of course, because they're so cute and everything. But there's something to be said for having at least like an adolescent dog or cat.
I agree.
Yeah.
Yeah, puppies are a lot of work. If you want to do it right, they're a lot of work.
Yeah, puppies, they're not potty trained. They want to chew everything.
Yep. Oh, yeah.
They are highly energetic. They whine a lot. Older dogs, they get a little settled in and stuff.
Chill out, and they know where to poo.
Yeah.
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 So
I say this because a lot of people prefer to get puppies and kittens, and will reject older animals.
Oh,
you know what I mean?
Yeah,
which isn't cool.
It isn't, and I prefer to adopt a pup like this one, who's about 1.5 years old.
Now, if any individual just prefers kittens or puppies, great. But if the overall market, it's sort of like I one time adopted a 10 or 12-year-old cat that was a black cat, and he had it coming and going because he's old, so no one wanted to get him, and also too, he was a black cat, and there's all this superstition around fucking black cats.
It's weird.
But anyway, so congratulations.
Yeah, we'll see. He's coming in at end of June, so a few weeks, and we'll meet him in person.
All right. So getting back to the email.
Right. Yeah. Right.
What I will say is regarding the totem in the elevator study, I think it's important research, and I support its finding, or the findings are congruent with the way that I see these sorts of things, but it's overly simplistic to just focus on that one thing for any individual suffering from trauma and recovery or agoraphobia.
Yep.
If we just focus on the totem thing and you keep all things equal, then you see an increase in people with totems having increase in the phobia, even with treatment, that kind of thing. Like if I had a client who was working on a phobia or OCD or trauma recovery, because it's all kind of in the same category, it's exposure. And if I had a client that wanted to have a rabbit's foot with them all the time, it'd be something that I'd be thinking about and evaluating. But in the grand scheme of things, like say that, let's just go with elevator phobia. And there was a client that, wanted to recover from that. So it involved the cognitive part and also the exposure part. And I heard from a client, he's telling me, I have this rabbit's foot and I'm going to bring it with me. And I would say, well, do you need that? Because it actually could interfere. And he's like, no, I really need it. It's my lucky rabbit. I don't know if I'd be able to do it without it. And I'd be like, I don't know, security. But even if there was a deleterious effect from the rabbit's foot, if I am allowed to fully engage with the client in the full course of treatment for exposure and cognitive therapy, it won't matter that they had a totem, because the anxiety, and at some point we would get to a point where they wouldn't be able to bring the rabbit's foot with them, and we'd have to experience that feeling and those cognitions, like, okay, well, now's the time when we separate yourself from the need to have the rabbit's foot. He would probably have all these worries, but it would be much less because he would have gone through a lot of exposure therapy and a lot of cognitive, a lot of emotional regulation, a lot of experience with having it go well. And, this can apply in all sorts of ways. Like when I'm working with clients with phobias or PTSD, there's a period of time when all of their anxiety and their recovery is involving me. I'm kind of like a totem, right? I'm there to talk with them every week. I've guided them. At some point, the therapy is going to end in all likelihood, especially with these kinds of therapies. And that's a transition that we have to talk about, that, okay, you're not going to have me to talk to since you're terminating with me. You might have a resurgence in anxiety because the catastrophization or the automatic thought or the association that there's a part of you that might believe that your recovery and your safety is dependent on checking in with me every week. But that's not the case. 99% of your success has to do with you. So, there's a lot of different hurdles that are similar to the rabbit's foot potential hurdle in the future. It's so to me, that's how I see it. And if an animal is related to that, then that's what it's related to. But the other thing that I think of is that in general, it's a similar concept of agoraphobia, where when we have anxiety about something, we will try to solve it, right, naturally. And we often will engage in coping mechanisms that really have nothing to do with solving the problem and just have to do with limiting our lives. Like with agoraphobia, someone could, for example, have a fear of throwing up in public, and they try to deal with that as they're going to work and going to the grocery store. But eventually, because they're not being treated and it's getting worse, they eventually just say, I'm never leaving the house. So they're not afraid of the outside. They're just afraid of throwing up. And that's the main problem. And they're limiting their life such that they don't have to face that problem. Yeah. And so you have someone in the beginning of that development where when they leave the house, they don't have a ton of anxiety, but they are kind of worried about throwing up. Fast forward, and a couple years down the road, just looking outside could cause them anxiety because they have to acknowledge there's an outside world that they might have to enter into, which might lead to them potentially having a feeling where they might throw up, which might lead to them throwing up, which might lead to them being humiliated. It's based on all these layers that have been developed from the original phobia sensation. And those are destructive layers. They ruin people's lives. And to have a totem could be just one of those things. It's like if this is the principle that we're going to rely on these or not ultimately helpful coping mechanisms, because it's not. It helps kind of in the moment. It's to have to not leave the house or to have the rabbit's foot. It helps, but if that's the principle that you're following and that's the principle that I'm enabling as a clinician, then we're not heading toward what we need to get to, where you can leave the house without any totem, or you can get on an elevator without any rabbit's foot, because you no longer have the mindset and the neurology that leads to anxiety. Because if we endorse the rabbit's foot, then we're kind of endorsing this idea that you are dependent on these elements like this that really have nothing to do with recovery. It's just like a patch that you put on something, a temporary, like a Band-Aid, and if you end up endorsing that as a therapist, then you might be setting the client up for failure ultimately. But it's complicated, like I said, and case by case basis. Okay. So let's take a break. We get back. Let's read the rest of this email, because we've only gotten about a third through the email.
Oh, golly.
All right, we're back from the email. I want to do an OPP. So we've done all the names of those people who have, at least at the time of doing the OPP, they were still patrons, having signed up a while back. And I'd gotten up to the year 2022. But before naming those names, I wanted to go back to the very beginning and talk about the folks who are patrons now, who signed up years and years ago. And I started with those people, those like 10 or so people that signed up in 2015 and are still patrons after all this time.
Yeah.
And then we also listed some people from 2016, and here's some more from 2016. So these people, not only a patron, but they've been a patron this entire time. So it's just 8 years.
8 years.
I mean, that's amazing. So we have Gayung from Seoul, Korea. We have Scott from Gridley, California. We have Darren from Barrie, Ontario. We have Tammy from Weymouth, Mass. I'm guessing it's probably not Weymouth. It's probably Weymouth, right?
Probably, yeah.
Just guessing. Hannah from London, Great Britain. Megan from Hopkinsville, Kentucky. Anna from Atlanta. Tanya from Massachusetts. Adam from Clinton, Maryland. Brooke from Australia. And Sid and Jay Dispensa and Neil from God knows where. Thank you for becoming a patron all the way back in 2016.
Wow.
And staying a patron through just so many phases of this podcast,
I just re-signed up this morning for my year-long membership.
Oh, you did?
Yeah.
Going on with the email. I have a history of anxiety that came on strong in my teens and plagued me for years before I realized it was anxiety. My main trigger, so again, this is Leah from LA. My main trigger was the risk of needing a bathroom and not having easy access. So similar to the throwing up phobia. 15 years later, through years of therapy and other things, my anxiety is now pretty low. And although I still sometimes deal with it, and I definitely request aisle seats on an airplane, I no longer have it on my mind 24/7 like I did for years in my late teens, early 20s. Reflecting back, I can now see that some of my behaviors definitely worsened my anxiety. For example, when my anxiety was super high and I was regularly having those physiological symptoms like pounding heart, dry mouth, sweaty palms, hot and cold flashes, digestive disturbance, panic, etc., I would avoid certain things like carpooling and public transit, and also engage in behaviors that became sort of compulsive, like peeing once or twice right before leaving. But even before therapy, I would push myself to do things that were out of my comfort zone as a way of reducing my anxiety overall, even though it was really difficult for me. So my question is, do you think the fact that I essentially would expose myself to experiences that were triggering was at all similar to exposure therapy? But first, let's answer that question, Bob.
It's exactly exposure therapy, and it's fantastic.
Yeah.
My guess is there may have been times when you could have and didn't, and times when you could have and did. The one thing about exposure therapy is it tends to be systematic and constant. So in other words, if I'm going to expose to this particular cue, I do it every day, as opposed to ad hoc or when, right? But what you're describing is fantastic.
Right.
And God love you, man. That is hard to do.
Yeah. Well, as someone who suffers from anxiety myself and phobias, I don't engage with a therapist. I just do it on my own, and I utilize all the skills and knowledge that I have as a therapist, and I just do it on myself. And I do this sort of thing, is that there's a why in the road, and it's case by case. And of course, if you're not a professional, then you should work with a professional on how to do it, because there are those principles that you have to make sure that you are actually sticking with it, and it's a long enough period of time such that your neurology actually will change. Habituation takes time, and there are ways of making sure that you're doing that instead of re-traumatizing yourself. But for myself, I have engaged in this sort of mindset of where I'll feel the phobia, then I'll feel the avoidance technique as a option pop into my head. And then I tell myself, if you engage in this avoidance, by doing this, it's not going to end the anxiety overall. It's just kicking the can down the road, and I'm just adding a problem to my life. Like with this example, I didn't have this anxiety, but just using this as an example of, she's saying before, I would essentially expose myself. She's about to leave the house, or she's like, I'm leaving the house in half an hour, and this intrusive thought pops in her head of like, oh shit, what if I am stuck on the bus and I have to pee and I end up peeing my pants or something? And then the anxiety and the hot flashes and the sweaty palms and the digestive disturbance and the pounding heart and the dry mouth, it all starts to escalate. And then this solution pops into the head of maybe even I just won't leave the house, or I won't take public transit. I will annoyingly drive my car and look for a parking space, and I'll have to leave 3 hours earlier because of parking, and I'll end up paying a lot more money, and and then she says, she would say to herself, just as a for example, of just like, no. If I do that, then it's just going to kick the can down the road. It'll mean that the next time I leave the house, I will have to do that again. I'll have to get in the car and I'll have to look for parking. No, I draw a line in the sand here. I'm not going to do that. And through experience, or I trust that I'll survive, and it might actually help me to learn that getting on the bus is not something to be terrified of ultimately. Because if I avoid that, it becomes an unknown thing that I won't be able to predict what will happen. Whereas if I expose myself to it, I'll see that it's not the boogeyman that I think it is. Again, if you're a lay person, you should talk with a therapist about this. But yeah, I would. That's what you're saying, Bob. That's great. Going on, I didn't have a therapist back then, but I did know about deep breathing, and I would just breathe, which is also great. I could make it through the anxiety spikes, but it was not pleasant and never felt rewarding or like a victory over anxiety. So I think that's it. It was not pleasant because, of course, that's exposure therapy is not pleasant. It's not supposed to spike to extreme distress to re-traumatize you, but by definition, you're a 4 on the distress scale. But she says it never felt rewarding, and it never felt like a victory over anxiety. Instead, I always came out of those experiences feeling depleted and exhausted, as well as frustrated that I couldn't be more in the moment. I think I may be on the obsessive compulsive personality disorder spectrum too. So maybe I just feel flaw shame at the fact that I have anxiety at all. End of email. I love it when people say end of email. Bob, what's your response to that?
Sounds like you know yourself well.
Yeah.
And sounds like you've done a great job. I don't think, though, that people experience a session of exposure. I don't think they walk away from it saying, what a victory, I think they walk away from it maybe pretty tired.
Yeah.
And it might be, the thought that went through my head is, in these moments when you felt so depleted, it might have been, that you're really in the deep end of the pool, like really intense stuff. Whereas if I was doing exposure with somebody, you can do it that way, but the current wisdom, as I understand it, is you graduate it. So you start with something that's provocative, but not overwhelming, and not a softball, not too easy. Just it's sort of like the Goldilocks, just right, just in the middle. And then you start with that, and you work your way up to more and more intense situations, which generally will actually decrease in anxiety as you go, simply by exposing to this cue that's maybe a 5 out of 10 in terms of how anxious it makes me, and the cue that's a 9 out of 10 that it makes me, that 9 might actually come down on its own just by doing my 5s. Mm-hmm. So it might have been that you just found yourself doing 9s and then feeling pretty wiped out when you were done. Yeah. Anybody would.
Yeah.
Yeah.
Right. So here's my suspicion is that because you weren't in therapy at the time, you didn't have a therapist that could frame the whole situation for you, and you were just left alone feeling like there was something wrong with you. Even though you were doing good work to some extent, you felt like, well, I'm a failure just having to do this in the first place. Instead of a therapist telling you that you're doing great and you're doing a lot better than other people and this is normal.
And also, there's a lot of other people who have this kind of suffering.
Right. Anxiety is the most common disorder that one would be diagnosed with in their lifetime. Phobias being one of them. So that's one suspicion. The other suspicion I have is that you were dipping in and out of exposure therapy, and it wasn't a victory in the way that it didn't feel like a victory, but it also wasn't a defeat. You weren't going down you were staving off it getting worse, but it wasn't getting tremendously better because you weren't on a regimented regime. Because with proper exposure therapy, you enter a period of time where you spend a lot of your free time being purposeful with your exposure. Whereas if you're just ad hoc as it comes up, dealing with it, then you're not giving your nervous system a chance to habituate. But again, you're staving off the avoidance cycle that could spiral you to full-blown agoraphobia or something. And those were victories, but you weren't actually getting tremendously better the way you would have if you were doing purposeful exposure. So you were probably doing a lot better than other people, Leah, and you were biding your time until you got into therapy. So those are my suspicions.
Laura's natural instinct was towards, Leah's natural instinct was towards health. Like she knew, I got to do this. Like, that's just fantastic.
Yeah. And I don't know if this is where it came from, but for me, it comes from anger. I'm just like, fuck this shit. I'm not going to live this way.
Fantastic.
Which can be directed at the source, which is, I don't give a fuck if I pee on the bus or not. And if anyone has a problem with that, they can go to fucking hell. Because that's the truth, It's like if I pee or if I lose my shit when I'm in an elevator and embarrass myself, then people are just going to have to deal with it because I deserve to take up space in the world, and I'm not a perfect human being, and it's okay,
Functional anger. That's functional anger. It's fantastic.
Yeah, like for me, it was medical phobia, and I directed that anger into being assertive on the table. The first time this really happened that I remember was I was having minor surgery on my mouth, and I told the surgeon that I didn't know because I was referred to the surgeon by the dentist, and I said that I have a tendency to faint, not because there's anything wrong, but because I have a phobia and I will have a vasovagal reaction. And the surgeon said, "Oh no, you'll be fine because you'll be laying down and everything will be fine." And I said, "No, you don't understand. Like, there's a good chance I'm going to faint, or I'm going to almost faint. Like, I'll have tunnel vision and my body will be freaking out, even though my conscious mind knows that there's nothing wrong with what's happening." And he's like, "Oh no, you'll be fine. Everything will be fine." And I was like, "Dude, you don't." I said, "I'm a therapist.
Yeah.
I understand these things. I'm telling you, there's a chance. And so what we're going to do is that if I raise my hand, you're going to pull your hands out of my mouth immediately. That's what's going to happen." And he was like, "Oh," and the nurse the assistant was kind of like, trying to take over and be, "Okay, yeah, that sounds like a plan," because the surgeon was just completely oblivious to, and I've experienced that so often.
It's amazing that a surgeon who's got some experience would be like some dumb yokel who fell off the turnip truck, man. Come on.
Yeah, it's wishful thinking. It's a matter of training. It's ignorance. There's just a lot of ignorance about anxiety and phobia and fainting and fight or flight. And now many clinicians know about it, but many don't. And so lo and behold, soon into the procedure, I started to almost pass out. And because I knew enough about medicine to know that if I pass out, it really complicates it. Because sometimes when I would faint, I would convulse. I would go into, it's not a seizure, but your body is trying to get blood back into your brain, essentially, by convulsing. And it would freak people out. And I would also wake up in a state of a daze, because my brain would have lacked oxygen for a period of time, such that I'd wake up with confusion and a headache, and it would be hard to proceed. So it was within his interest that I work with him on this, because if I didn't, then I could faint, convulse, and then we'd have, because it had happened before where the physician said that, because it freaked out the physician, and so he wanted to postpone it and have it another day. And I'm like, that's just kicking the can down the road, sir. So let's get this fucking thing over with. I'll faint next time. It might even be worse next time because I fainted this time. And so my body, my conscious mind understands everything's fine, but my body does not. My body has no trust. My body apparently feels a lot of danger in this situation. I personally don't, but my body does. And so, I'm trying to work with the surgeon and, got him on board. And then, 10 minutes in, I raised my hand as I'm about to pass out, and he pulled out of my mouth, and I took a deep breath and things calmed down. And then I said, "Okay, I think I'm ready to go." And, it took a 20-minute procedure, took it like an hour instead, but, I got my needs met and got through it. So it's another way to see it, is like, just get angry at the thing and assert yourself and take up space in the world. And lo and behold, the next time I had surgery in my mouth, I was a lot less anxious, because I got through that instance with control and power. Like with claustrophobia, a lot of people are worried about claustrophobia, but they're half, if not more than half, worried about having to assert themselves to avoid claustrophobia. Like, people will be claustrophobic, like with Leah, she wants an aisle seat in the airplane. Why? Because, I don't know, but a lot of people are like, well, I don't want to have to bother the people sitting, in the aisle to get to the bathroom. That's a good place for your anger, of just like, fuck that shit. If someone's going to have a problem with me having to jump up and go to the bathroom, that's on them. I'm certainly not going to be a dick about it, but and I might even get angry and say, as soon as I sit down in the middle seat and look at the person in the aisle and say, I apologize for this, but I have a phobia about having to go to the bathroom, and I also have a phobia about bothering people by asking them for help for me to go to the bathroom. So I'm telling you this because I might be a little weird when I have to go to the bathroom, and I have to, and I'll be polite and ask you, is it okay? I just want to preemptively ask, is it okay if I ask you to move if I have to go to the bathroom? And then, likely the person will say like, oh yeah, it's fine. Just say the word. Or if they're a dick about it, then you can say, fuck that shit. They're a dick about it. I don't mind bothering them. Like get angry, people. Like you deserve to not be in a state of utter panic about bothering other people's lives. You know what I mean? Or if you're in the middle seat of the movie theater, a lot of people, whether it's a claustrophobia or a bathroom anxiety or a throw-up anxiety or a fainting anxiety, they don't want to sit in the middle of the theater because they're worried about being quote unquote impolite or bothering other people, Anyway.
Yeah.
All right, let's take a break. One more email. What do you say?
Yeah.
All right, this next email is from patron Jen from New Jersey. She says, "Hi, Kirk, Bob, Umberto, and Rebecca. I have a lot of trouble holding on to my own opinions and thoughts about things. If someone else becomes angry or upset with me and I express a strong opinion, it jumpstarts this whole obsessive process in my brain that can go on for months. So if someone else gets angry or upset at me and expresses a strong opinion, it starts this whole obsessive process that can last for months," meaning obsessing on the other people getting upset at her. "I've listened to a lot of your podcasts, and I do think I have a solid sense of identity," meaning connection with the self, "but I would say I have a more preoccupied attachment, and that that may be more related to what's going on here. Specifically, it feels related to my experiences as a child with my father when he would drink. Sometimes something inside of me knew I was more responsible than him at these times. So I took the keys and threw away the beer and told him to stop drinking." Oh, I see. So when he would drink, she said, since he's drunk, I'm the only adult here, even though I'm a child. So I need to make sure that I take care of things. That led him to blame me, and he would blame me for ruining his good time. I just remember feeling devastated as a child and second-guessing my own opinion of what was right and true in the world. Oh, I see. So she's saying that, through this experience, I have trauma and a schema around people blaming me or being upset at me because I was in this bind of having to be the adult in the room for safety's sake, and this irrational person that I wanted attachment safety with and love and acceptance from would yell at me for being responsible. So that's an interesting, thing there. Yeah. That is how I feel now whenever someone gets angry at me. I recently had a huge fight with a friend. She is super angry with me right now. I don't agree with her perspective, but I do understand her thoughts and feelings about the issue. Unfortunately, she won't talk to me and doesn't want to try to resolve anything, which has me feeling devastated. Even though I don't agree with her, there is still a huge part of my brain that ruminates and worries if maybe she is right, especially because she was so angry. It throws me off in a huge way and brings me back to a place of second-guessing what I know to be right. I have a therapist, but we haven't started talking about this yet. I'm curious what you guys would say. Thank you. Bob, what do you think?
I think you should talk to your therapist about this because at some point it's going to be you and your therapist. What a fantastic opportunity that'll be.
Meaning that this dynamic will play out.
It will.
That the client will perceive or make the therapist angry and critical of her, and then she will have that feeling of like obsessing about that and feeling ambivalent around was I wrong, was I right, that kind of thing. Yeah.
So the potential for a corrective experience, presuming the therapist is good at their job, is, it's fantastic. Because dad dropped the ball. That sucks.
Yeah.
And at a time when your brain is developing, and so you get some funny ideas about, what you're supposed to be in the world. So the good thing about the therapist is that is a potential corrective relationship where there's a strong person who can take care of themselves, who doesn't need you to agree,
Right.
doesn't need to shame you in order to feel better. They won't step on your head just so that they don't drown. So yeah, and is that going to solve it all? Nah, probably not.
Yeah.
And the thing I get this thing about with your friend, that's happened to me too. I can think of one example right now off the top of my head where a friend of mine was really upset with me about something, and my response to it was really extreme, like, feeling really ashamed and really bad and really convinced that I was in the wrong, as if it were such a black and white thing. And only by distancing myself in that friendship have I come to sort of have a perspective that is more balanced, which is to say, we both contributed to that, not just me. And their response to me was extreme. It was extreme, actually. And
Not taking responsibility.
yeah, their response of not taking responsibility.
You were taking responsibility for your side.
I was trying to, yeah.
But
yes,
they weren't.
They weren't willing to do that. And so I withdrew from that friendship to a large degree, and that's fine. That works. Actually, that's fine. That's a good idea, actually. If it's not going to change, then why put up with it? You're not contractually obligated to be a friend, and friends break up sometimes, so big deal. Get a different friend. So the one that's not talking to you anymore, it doesn't mean... We don't know. We're not there. So we don't know what it's about. We don't know anything about it. But we do know that, most of the time it takes two to tango, and it's never one person. And so whatever your contribution is, and there's probably something, I don't know what it is, but there's probably something. Okay, fine. Though the something doesn't mean that you're wrong. It means that something happened, and, you guys are in this thing. There's lots of people in the world. So find somebody else. I know it's easy to say, harder to do. But on the other hand, what's the alternative?
Mm-hmm. Yeah, there's just so many details to this that I could get to, but we don't have time. But so I'm just going to splatter a bunch of stuff at the wall, and you can tell me if any of this fits, Jen, or maybe all the above or none of the above. One, what you went through is horrific, and will, as you identify, do a number on your emotions and your assumptions and your preoccupation, your worry of rejection, this kind of thing. Maybe over-focusing, hypervigilant on other people. You identify as being preoccupied, so that'd be a part of it. And it, given what you went through, it could attract you to people that are like him, like your dad.
Oh, right, yeah.
People who are underfunctioning, that require overfunctioning. That's what happened to you. You were parentified, and you might be codependent. You might, I don't hear that in your example, but that's just what I'm splattering at the wall, which could mean that the sort of people that you attract and the sort of people you're attracted to in terms of friendship and romantic might be by definition underfunctioning, and bring that to the table while you bring overfunctioning to the table, which can, without awareness and recovery, lead to these kinds of blowups where the underfunctioner can be angry for legitimate reasons and illegitimate reasons, if that makes sense. And a lot of things can be happening at the same time, as Bob was saying. You could be right, and your friend could be right, and you could be wrong, and your friend could be wrong. Each of you could be bringing something to the table, And in terms of making up, that's a whole other topic. But it really just depends on what happened. If the friend was the abusive one, then there's that. But you could have been the abusive one. Your friend could actually be 100% justified in being angry and reacting to you. We just don't know. We don't know the situation. So there's that. Also, given what you went through, it would be understandable to have a complex that's quite black and white about these situations that involve all the different phases, not only just the buildup around the conflict, but when the conflict is overt, the way that you see it might be quite black and white, where there's a part of you deep, in terms of what you went through, there's a part of you deep down that knows that you're right because you're looking at your dad and he's drunk and it's right to take his keys. you either just knew that or you had support from other people. It's rational. But there's another part of you that feels like, well, I'm also wrong. I'm 100% right, and I'm 100% wrong because biologically I am designed to take cues from my attachment figure, my caregiver, my father, and he is telling me that I am 100% wrong. So I'm also 100% wrong, and worthless, and not lovable. Even though I'm trying to save his life and mine, by the way. So which one is it? It's everyone, and it's none of them. And my experience with people that have these complexes are quite extreme in the way that they interpret things and the way they react. And there's no nuance. There's no differentiation because the person is denied that opportunity, and they can't land on anything that makes sense to them because of this overwhelming voice and just alarm bell of like, you're 100% right and you're 100% wrong and worthless, and no one is there for you. You're completely alone, and you just have to figure this out for yourself, and you're going to fuck it up because you're worthless. There's no way out of that is the thing. And it's hard to differentiate. It's hard to determine, am I part of the problem? And that's the way we would normally think about this, under normal circumstances. That's the way that other people might react to you if you were to confide in someone else. But, prior to recovery and awareness, it's almost impossible to navigate those waters. And even if you did, the emotional side wouldn't resolve. It would still feel as though you're worthless and that you're also wrong and you're 100% right and righteous. So as you get recovery, that's when you can start to go through situations like this and gain some ability to differentiate and look at it after the dust settles and say like, okay, what happened, and what part of it am I responsible for? And if I am responsible for it, then how do I approach the other person? It's really complicated. It can seem simple, like, well, clearly someone, the way that the internet reacts is it's like, someone's right and someone's wrong. And that's just the end of the story. But, as evidenced by the way Bob and I are talking about it, that's one, not even a useful way of looking at it. And two, it's way more complicated than that. And your friend brings some trauma to the table as well. I've only been talking about all the initial possibilities just for you. Your friend probably brings a whole other equal set of traumas to the table and schemas and misperceptions that if the two of you are going to work something out, also have to be navigated in therapy and whatnot. So it's complicated, but anyway. All right. Well, thanks for those emails, Jen and Leah and everyone out there. Please take care of yourself because
you deserve it.